Good evening, everyone. Welcome back to the Ask Me Anything. I'm Dr. Twyman. I'm a board-certified cardiologist. I help people avoid heart attacks and strokes at my practice, Apollo Cardiology in St. Louis, Missouri. I've been doing these IG Lives since 2019 when COVID shut down the practice for a bit and I had to do telemedicine and help people optimize their lifestyles to really reduce the risk of the virus. But the same things that helped you build your resilience at that time is very good at helping reduce the risk, the damage of your endothelial glycocalyx, and it can improve your vascular health. So I do these IG Lives every Monday, 6 p.m. Central Time, because I really do enjoy educating people to understand how their vascular systems work and why, if you're going to take statins, for example, what are the risks, what are the benefits for your particular individual case, and that there are alternatives for lipid-lowering therapies other than statins, but also that vascular disease is not all about cholesterol. You have to look at nitric oxide, oxidative stress, inflammation. You can look at genetics. There's many things that affect the vascular health, maybe 400 things. So every Monday in my stories, I put up a Q&A box, drop your questions in, I answer them in the order received. As we're going through those questions, if people drop questions in the comments, I'll try to answer those as well. If people are looking for more information, I'm always happy to work with people one-on-one in my practice, Apollo Cardiology. I still am accepting new patients. I'm still blocking out time for about 2 months in the future. My website, drtwyman.com, has the application. A member of my team will discuss the logistics of how to work with us if you're wanting to do that. The application takes 2 to 3 minutes to fill out. If you're looking for just more education, I do have a school community. It's drtwyman.com/school. And in that group, I do, hour-long Ask Me Anythings. It's more interactive. People can share more, information. They can pull up their labs if they like. I'm starting doing some case studies in there. I have multiple, kind of courses on how to read your own labs, how to, look at advanced vascular tests. I'm very big into, using AI to analyze vascular health in my practice, but I'm using AI to teach myself and to create infographics and ways to teach people how you can break down complex topics in more bite-sized chunks. So my school community is where I share that. So last week, I know I had to move this to a Tuesday because I was out doing a forest bathing course, or class, I should say, out of the Missouri Botanical Garden. So for those that are local to St. Louis, the Botanical Garden is amazing, particularly this time of year. And they have all sorts of different classes, but this was a forest bathing class. It's based off of Shinrin-yoku, which is the Japanese word for forest bathing. It is a service that was started in the 1980s for people who used to be, out in the fields, got moved into working in factories, and then kind of got disconnected from nature. So they realized people had higher stress, more chronic diseases. They brought them out to the forest and were helping them kind of rebalance their nervous system. So that Shinrin-yoku, very popular in Japan. When I was there a couple of years ago, went on a few long walks through the woods there. It is not exercise. It is not fast-paced. There's no agenda. It's just being in nature and just reconnecting with nature. So we were there about 2 hours. If you're interested, I think they offer the courses at least once a month, except for the hottest month in the summertime. So with the housekeeping out of the way and the update on Shinrin-yoku last week, I'll jump into the questions. First question up tonight. I would tell people, this is for educational, purposes only. I'm not your doctor unless I'm your doctor. So if there's a question that says, should you be doing something? I can't answer that unless I'm your actually doctor. So talk to your own people if they're prescribing these type of things. But this person's saying, is it safe to take a statin with cardiorenal syndrome? The short answer would be yes in that case, but with heart failure, possibly not. If you have myocardial dysfunction, you definitely probably have some mitochondrial dysfunction, and you may not necessarily want to use a statin in that case. You would likely be depleting CoQ10, and mitochondria can be affected by statins. So if somebody had heart failure and severe dyslipidemia, I personally would lean towards more using ezetimibe or PCSK9 inhibitor. I see this on occasion. So how to stop lipomas? Majority of them are genetically driven. So if you have family members with lipomas, you're one of the unfortunate ones that has the genes that tends to grow these things. Trauma to the tissues can cause lipomas, and sometimes severe dyslipidemia or high lipids may drive them. They are benign tumors. They are cosmetic. Sometimes they're big enough that they're, bothersome and you may need a surgeon to excise them, but there are no true ways to stop the lipomas. Question I get often in the practice: is there any evidence that statins cause or contribute to dementia? The alternative theory is actually more likely, is that statins decrease dementia. Dementia is multifactorial. There's often an energetic issue. There's glucose disposal issues, diabetes type 3 of the brain, microvascular disease. So what's good for the heart is good for the brain. So if you don't develop plaque in your heart arteries, you decrease the risk that you develop plaque in your carotids or the small vessels to the brain. Statins deplete the cholesterol pool in the liver mainly. There is a lab called desmosterol that you can get assessed with some advanced vendors. If desmosterol levels are getting low on statin, there's more risk that you may have brain fog, and then in that case, decrease the dose of the statin. Or if there's a good reason for you to be on some type of lipid load therapy, consider using a different tool, as I say. So ezetimibe, PCSK9 inhibitors, Nexletol. Next question: when feeling exhausted all the time, seemingly without reason, can it be something with the heart? Absolutely. It can be due to ischemia, lack of blood flow to the heart tissue, so severe blockages in the heart arteries, may be more brought on with activity, particularly exercise. A cardiomyopathy, weak heart muscle, can cause people to feel fatigued all the time. So an echocardiogram can assess how well the heart function is working. So is ejection fraction normal? Is ejection fraction low? Does the person have diastolic dysfunction where the heart doesn't relax well? That can be ruled out or ruled in with an echocardiogram. And then a good history and potentially other testing may be needed to figure out, is it an ischemic cause? So a stress test or a CT angiogram may be necessary. But there's many reasons for fatigue. It could be thyroid dysfunction, it could be anemia, it can be sleep apnea. So I wouldn't just say it's definitely the heart, but got to rule that out. Next question: how does regrowing mitochondria with a new technology help the heart? I don't know exactly what new technology you're speaking of, but your heart is energetically demanding organ. It's beating 24 hours a day from the day you're born to the day you die. It doesn't take a break. So your mitochondria are making energy for the heart. Approximately 1/3 of your heart is made up of mitochondria. There's maybe 3, 4, 5,000 mitochondria per heart cell. So if your mitochondria are getting dysfunctional or you're having apoptosis or damage to your mitochondria, then the heart may not pump well or the heart might not relax well. This is probably one of the main reasons why people get cardiomyopathies. And if there's a technology that helps the person regenerate mitochondria or repair the damaged ones through mitophagy, then the heart function may improve. Beetroot capsules versus beets. So beets have nitrates. Nitrates, if you have nitrate reducing bacteria in your saliva, will break down into nitrites. Swallow the nitrites. If you have stomach acid, a chemical reaction occurs that ultimately releases nitric oxide gas in the stomach. The nitric oxide gas dilates the arteries, helps blood pressure stay normal, keeps the arteries elastic, and may reduce the risk that cholesterol particles and other blood components stick to the arteries. Beets, generally you need a couple hundred milligrams of nitrates from them. It's very hard to standardize a beet that is, organic or non-organic. The other issue is that if it's organic, it's going to have 10 times less nitrates because fertilizer wasn't added to the soil, because you can't add that type of fertilizer to keep the organic status. So it's not saying people should eat conventionally grown beets, but trying to get enough nitrates through organic beets is going to be very challenging. The beetroot capsules can standardize the dose, but you generally need a couple hundred milligrams of nitrates, and there's various vendors. Some of them barely have any nitrates, some have a decent amount, but it's test, don't guess. So if people are taking beetroot capsules, you can use the celery nitric oxide test strip to see, is it bright red? That tends to indicate that you have a high quality product and you have a healthy oral microbiome. If you have access to checking things other than blood pressure, you can look at arterial elasticity. If you have good arterial elasticity on a pulse rate velocity test, or you just have blood pressure less than 120/80, you're generally probably making sufficient nitric oxide. All right, somebody says they have heard that Cleerly scans tend to show more soft plaque than is actually present, realizing you only know if you have to go in and look. What's my experience? So I've been using the Cleerly scan for over 4 years. I have a couple hundred different basically scans on various patients from all over the country that have done this test with me. The scan uses AI to analyze CT coronary angiogram images. The AI is reportedly to be more sensitive at seeing smaller plaques in the arteries than the human eye would see. So my best understanding to date, particularly after recently attending the American College of Cardiology meeting in April, where I asked some of the world's experts in CT coronary angiography, what is the state of the art on AI analysis, is that get a CT coronary angiogram, have a human read it. If the human reads it as normal, stop. Don't do AI analysis. There is still some thought that maybe there may be some AI hallucinations of things in arteries. If the human reads the CT angiogram as abnormal, then send it off for analysis to quantify the type of plaque. Plaque generally comes in 3 types on the Cleerlys. It'll have non-calcified plaque, which is soft plaque. It'll have very low density plaque, which is soft plaque, but more likely to be inflamed plaque. In that inflamed plaque is more likely to rupture and cause heart attacks, and it will have calcified plaque. Now, does it have more soft plaque than is actually present? That is something that you're correct. The only way to know for sure would be to have an invasive coronary angiogram and having intravascular ultrasound where they would quantify how much plaque is in the walls of the artery. So this is a newer technology. So you have to pick the right patient for the test, and you have to know what you're going to do with the information. There's some people out there getting Cleerlys through other means, and they're just given the results. But it's much more about explaining, how did that test become abnormal? What can you do for it, lifestyle-wise, supplement-wise, medication-wise? And if you're going to repeat something, you generally should do an apples-to-apples comparison. Repeat it on the same scanner, use the same vendor. There's other vendors that are using AI, that can look at plaque. I'm experimenting with them. I have a demo account with one vendor right now, and I'm comparing a CT angio to Cleerly and the new vendor and seeing what the differences are. So this is right in my wheelhouse. I'm very much, at the tip of the spear, trying to understand what is driving the plaque and how best to image it with these type of technologies. All right. Well, I'm not seeing any other questions come in at the moment. If they do, I'll answer them. But for those that are just joining, I come here every Monday, 6 p.m. Central Time, answer your questions in the order they're received in my stories Monday morning. If you drop them in the comments while we're still chatting, I'll try to answer them. If you're looking for more Ask Me Anything type of information, my YouTube channel, drtwyman.tv, has the archives for the past few years, and I do longer form Ask Me Anythings in my school community, drtwyman.com/school. I also share some of the things that I'm learning currently. And oftentimes I'm using some different AI tools to kind of teach myself faster. And I try to teach people like, these are the tools I'm using. So if you're interested, the school community has a 7-day free trial to check it out. So next Monday, 6 p.m., I'll come back. But if there's anything I can help you with in the interim, reach out to my team, send me a message, and I'll happily work with you guys. So hope you have a great rest of the week.